Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to How to Stay Healthy, where we interview doctors each week across the vast medical landscape of cardiology, neurology, orthopedics, sports medicine, and primary care. Join us here for your prescription to better health. Hello, South Florida and beyond, and welcome to the How to Stay Healthy show. We have a really action-packed program here tonight because we've never had a chiropractor on this show in a year and a half. Yes, so without further ado, welcome Dr. Marilyn Shore.
Thank you. I appreciate it. I appreciate you having me here, and I'm happy to be here.
Definitely, and thanks for sloshing through that rain today. So anyone driving around or watching us on Facebook Live, please be careful, but also if you'd like to throw us a question, 1-888-565-1470, or on All County Healthcare Incorporated's Facebook Live page as well. Dr. Shore, I wanted to have you on the program because I want to kind of release the stigma about chiropractic care a little bit. I actually have never had chiropractic care, but my father, he really, I guess he kind of swore by it in a way.
Right.
It was something that he always, talked about and something that always helped him. He had a lot of back problems. So let's get right into it. One of the terms associated with chiropractic care, and I'll probably get this wrong, but subluxation.
Close. You did
Close.
pretty good.
Man,
Our first try.
I'll have to write it down phonetically. How do you say it?
Subluxation.
Okay, good. What is subluxation?
Okay. Well, most people think that chiropractic is for back pain or neck pain, but the truth is that chiropractic was started in 1895 by a man named D.D. Palmer. And D.D. Palmer was studying the relationship between the spine and the central nerve system, and he made the deduction that, well, if your spine houses your spinal cord and part of your brain, that if you have a bone in your spine, which we call a vertebra, out of alignment, and it's putting pressure on your central nerve system, that you're going to have problems. And so he wasn't thinking about back or neck pain or anything in particular. He just knew you wouldn't be as healthy as possible. So there was a janitor in his building who was deaf, and he proceeded to adjust the top bone in his neck, which happens to house the brainstem. And after he adjusted him, the janitor's hearing returned.
Whoa.
I know. It's pretty crazy. And so you would say, like, how's that possible? And that's impossible. But the truth is that, he had this vertebra that was pressing on his hearing stuff, and that when they released the pressure, that his hearing came back. It wasn't until over years that people started thinking that chiropractic was just for back and neck pain because insurances said you had to diagnose that, and because we worked on the spine, that people assume that was for your back. And I'm not saying it doesn't work great for back and neck pain, but it works great for a lot of other things, and really mostly to keep you healthy, whole, complete, vivacious, energetic, and just to be in balance. I mean, you keep your teeth cleaned, right? I mean, you go to a dentist and you keep your car aligned. Well, you got to keep your spine aligned because you can live without your teeth, but, your central nerve system controls everything in your body.
True.
So,
how often do people need to get their spine aligned? Does it vary from person to person? Do you kind of learn the person's anatomy to kind of?
Sort of, yeah. It's like when somebody comes in, you do an evaluation, which includes a consultation, a history, examination of the spine, determining subluxations. And how we do this is we feel the spine for these vertebrae out of alignment, and then take x-rays, and some people do scans, which is called thermography, to determine where the subluxations are, how long they've been there, and how long it will take to correct. Now, most people have had subluxations from the time they were born, which seems crazy, but you have your spine when you're born, and birth can be very traumatic. So vertebra can go, especially the top part of the neck, can go out of alignment from the birth process. So all babies should be checked. Like a pediatrician checks a baby after they're born to make sure their heart's working well, their lungs are working well, that all babies should be checked by a principal chiropractor that knows how to check babies. And then what happens is the chiropractor can determine whether the baby has a subluxation or not. And if it does, needs to be corrected. And most people are afraid because they think that, when they think of chiropractic, they think, you just turn your head around, you hear these big crunches and stuff like that. Well, on a baby, the pressure is so light and it's just a little finger with pressure on there. And that's it. But the results can be amazing. Like I've had kids with severe reflux, or what we used to call colic, that just by a couple of adjustments are resolved. Kids with ear infections, all different kinds of stuff. But I have a daughter, and I've been checking her since she's born. And
how soon after being? Let's start from the beginning. How soon after being born can someone bring their baby into?
Like right away. I've been at several births, as a matter of fact, and have checked babies right away, right out of the birth canal.
Unbelievable.
I know, and it's amazing. And then, a lot of babies are clear also, which means they don't have subluxation. But isn't that great to know that, the brain's completely connected to the body and is able to do the job it's supposed to do, which is heal you from inside out. Not covering up with, medications that just cover up what's going on. So.
Now, in most cases, you can feel this subluxation from outside of the skin, like you can without doing X-ray tomography through your training?
Yes. Yeah.
Wow.
Yeah. Well, I've been doing this 30 years, and, whatever you do repetitively for long periods of time becomes so innate to you that you know where it's right and where it's not right. So.
Now, moving on to children, now they would see you on a regular basis, obviously with their parents, and then adolescents, and then move into adulthood as well?
Yeah, like forever.
Okay.
And not like, people often say, oh, I heard when you go to a chiropractor, you have to go for the rest of your life. It's one of the concerns people have. And just so you know that, people go to a dentist for the rest of their life also. People get their cars tuned up for the lifetime of a car. People should eat good food for the rest of your life. You should exercise for the rest of your life. And so you should get your spine checked for the rest of your life to make sure it's clear of nerve interference, and your chances of having a better life go up. Completely.
Okay.
Yeah, absolutely.
How long for an adult does an adjustment take, and kind of take us through the process?
Okay. So when somebody comes into the office, like I said, they fill out some paperwork, they get a consultation, and we take a history. And sometimes when you've had physical, emotional traumas, or even chemical traumas, and people don't even know what chemical traumas are, but chemical traumas are taking a lot of medication is a chemical trauma. Preservatives in food, if you've been exposed to a lot of radiation, things like this are chemical traumas to the body. A lot of military people that are vets are exposed to a lot of chemical trauma. And, that can do a lot to your central nerve system. And then there's physical traumas, which we understand, like car accidents and football injuries. But there's also the subtle stuff, like if you're sitting a long time working in front of a computer all day, that's a physical.
Right here,
exactly.
I do that.
That can do it too. And, kids at a desk and poor posture. There's so many things that can cause subluxation. So I assess that. And
maybe even sleeping the wrong way, like we wake up and have that, like just all out of whack.
All right. I'm glad you asked that question, because people always say to me, I slept wrong, that's why I have this, or, I did this. And usually what that is that may have kind of brought it over the edge, but usually sleeping wrong, or what you call in a bad position, may aggravate what's already there. Because subluxations are, they can be covert, meaning you can have them for years and years and years and not have apparent symptoms. Your body's probably giving you clues, but you're not paying attention to it, or you would never relate it to that. And so it's kind of a build-up process, like heart disease or high blood pressure, and then one day it shows its ugly face. And why wait for that? Like I've been getting adjusted for over 35 years.
It's been there the whole time.
Huh? Yeah, they told me it was also.
Yeah.
I had problems, and I was a triathlete and a marathon runner, and I had no symptoms. And they said that, I have these subluxations, but I did get bronchitis 4 times a year from the time I was an infant. And after a year of chiropractic care, I stopped getting bronchitis.
Yeah. Talk also about, so your daughter has been getting chiropractic care since she was born, and you were telling me that, actually I read on your website that she's really never had to be on any medications, had any kind of antibiotics.
Never.
And that's, you attribute that to chiropractic care?
I attribute that partially to chiropractic care.
Okay.
But I'm also not one to hand out medication when a child has a symptom. I truly believe that your body's doing like having a fever for a reason. So if you're a kid, my daughter got sick, and I used to like be happy that she got sick, because that's how you develop your antibodies. That's how you develop a strong immune system.
The playing in the sandbox thing that we hear.
But yeah, even when you get sick. And so what most parents do, because they've been told to do, the minute they have a symptom, like take an antibiotic, take a Tylenol, take this, take a reflux pill. And so the child doesn't have any immune system to support themselves. And so you kind of have to fight your own battles. Like if your child is, picked on at school and you fight all her battles, she'll be a weak kid. You have to learn how to fight your own battles, and you have to learn how to fight your own physical battles also. So partially it's because I've been adjusting her since birth on a regular basis, and that also that I didn't medicate her, and I let her own body heal itself. But I had faith, if I knew that she was clear of nerve interference, that her body would do that. And it did every time, so.
That is fascinating. Now, another thing I found fascinating was taking a look at your website. I'm mentioning the website here, shorechiro.com. So that's Dr. Shore's last name, Shore, and then CHIRO.com. Dr. Shore's located in Delray Beach, 245 Southeast 5th Avenue, right in the heart of Delray Beach. That's a great area right there. 561-278-2727. I'll give out the info once again before the end of the program. But on your website, I found it fascinating that you have a lot of pictures of pregnant women that come to see you for chiropractic care. Talk a little bit about how, because this is something I did not know about, how chiropractic care can help, before pregnancy and during pregnancy and with right up to childbirth.
Sure. I mean, if you think about it, first of all, pregnancy, when you have this big belly in front of you, it puts a lot of stress on your spine. And so not only do pregnant women often have symptoms like low back pain and things like that, but again, if you look at the premise of it, is that you want to keep all the channels clear, that you're going to probably feel better, and you're going to, more importantly, function better, so that, it makes you more prone to have a healthier delivery. And if we keep the pelvis also in balance, it's less likely that you'll have complications during pregnancy and delivery. So it really was. I got adjusted throughout my whole pregnancy. And all the women that I've adjusted, say that, they don't have as many symptoms, that they feel more balanced. And it's good for the mom, and it's good for the baby. Probably good for the co-parenter too. So.
Most definitely. And I saw the picture. I'm thinking of the picture on your website. This woman, her baby was in one position in her stomach, and after the adjustment, it turned and kind of went down to the position it should have been in.
Right.
That's amazing.
They call that, when a baby is breech. The reason why most babies are breech, I mean, there can be a few other reasons for it too, like the pelvis, just the shape of the pelvis, so on and so forth. But if the baby is breech, it's usually because the pelvis is out of alignment and the baby cannot turn. Babies want to be head down in the birth canal. But if they can't, so there's a special adjustment of the pelvis. It's called the Webster technique. It doesn't turn babies per se, but what it does is it aligns the pelvis properly so the baby has the opportunity to turn, which the innate wisdom of the body wants the baby to turn that way. So
Dr. Shore, hold that thought. We're going to take a quick break,
Okay.
and on the other side, I'm going to ask Dr. Shore a little bit about why she left nursing to become a chiropractor on the How to Stay Healthy show.
Okay.
How to stay healthy. It's a question asked by many people and answered by few. On How to Stay Healthy with David DePino, I'm going to bring you the latest in health news by interviewing top doctors from South Florida and around the world. Tune in on Fridays at 5:30 p.m. right here on WWNN Radio 95.3 FM and 1470 AM, the Health and Wealth Network, to hear the latest health treatments. And my curveball question of the hobbies and passions in life doctors pursue when not providing medicine.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
And now back to How to Stay Healthy, your weekly doctor's interview and prescription to better health.
It's great.
And we're back on the How to Stay Healthy show with Dr. Marilyn Shore of Shore Chiropractic, right here in neighboring Delray Beach, shorechiro.com. I wanted to ask you, so when we were talking, I found out that you had been a nurse for many years, and then you decided to leave nursing to start your own chiropractic care practice. How did that happen?
Well, I'm going to make a long story very short. But I never really wanted to be a nurse. I wanted to be a nurse midwife. But to be a nurse midwife, you had to go to nursing school. So I got my degree. It was a 5-year program, actually, from New York University. And when I got out of school, I wanted to work in labor and delivery, and I couldn't get a job. So I ended up on an experimental chemotherapy floor at Mount Sinai Hospital in New York, which is a big teaching hospital. And when I went there, it was probably the most profound experience of my life, because I probably held 50 people in my arms as they passed on.
Oh, that's
And
tough.
I watched them go through. It was like a horror story. And oftentimes, the problem was from the medication, not just the cancer.
Mm-hmm.
And I'm not, saying this to judge what they do in their lives, but that stuff is called chemotherapy. It's chemical warfare on the body with radiation.
Mm-hmm.
And it can do some really horrible things to you. So when I
We
You
actually
okay?
got a caller.
Oh, we do.
Yeah, that's great.
Awesome. Do
So
we take
we'll
that
take
now?
John.
Okay.
John, welcome to the How to Stay Healthy program.
Hi, how you doing, Dr. Shore?
Oh, I'm doing amazing. Always.
Awesome.
John, do you have
I
a
have a
question for the doctor?
Yes, I do. It's a very specific question. I have a autistic son that's 10 years old,
Okay.
and I've done a lot of reading and research, and I've heard that chiropractic care can help autistic kids.
Okay. Well,
I would just like to know more about it and what you think professionally, whether or not it could. He is high functioning, but he's got a lot of irregularities when it comes to his movements.
okay. All right. Well, I have several autistic children in my office, and they're different levels of autism, but this is the thing about it. Again, chiropractic doesn't cure autism. Actually, chiropractic doesn't cure anything. It's really about me removing the interference that's blocking anybody's body from healing itself from inside out. And so with autistic kids and with anybody, if there is any interference to the central nerve system, it's kind of like a brain, body, spirit disconnect. And so if there's this brain, body, spirit disconnect going on, then you can't function at the highest level. So that when I feel the spine of an autistic child, or anybody for that matter, I can specifically feel where there may be nerve interference blocking connection of the brain to the body and the spirit, actually. So especially at the upper neck, and this is often found, again, during birth trauma, that the first bone in the neck, it's called the atlas, will go out of alignment, putting micro pressure on the brainstem. And that brainstem is what controls your basic bodily functions like your heart rate, your respiration, your digestion, but also can create emotional problems and functional problems in life. And so by adjusting that first bone in the neck, I'm not saying it cures the autism, but function can improve dramatically. Specifically, I have one man, he's in his 20, actually he's 30 now, but I've been seeing him for about 12 years. And it keeps him much calmer, and he doesn't have as many tics and jerky motions. And he's more relaxed and more at peace after he gets adjusted. And he gets adjusted on a regular basis. I see him one time a week, and I've been doing this for 12 weeks. I have another one who would get sick a lot, and he doesn't get colds and flus and fevers nearly as much as he used to. In fact, hardly ever. And I see him on a regular basis too. And so I hope that specifically answers your question. And yeah.
Well, that's great info, Dr. Shore.
Yeah.
And thank you, John, for calling into the How to Stay Healthy show.
I truly appreciate it. I definitely appreciate it, and I'll be seeing you soon.
Okay, that's terrific. I look forward to it.
That's fantastic news. And then also, obviously, we talked a little bit about it this evening, is how chiropractic care can help with chronic illness. It's something that if you're seeing chiropractor over a certain period of time may be able to help with different illnesses.
Total. Well, again, we don't cure anything, but it
Don't
can
cure
help
it, but
that.
yeah.
And like I said, when I worked on that in nursing, I felt like, well, you know, I know there are benefits to medication sometimes, and, you know, especially for acute care intervention, you know, you're in a car accident or you have a big
That's
brain
what
tumor.
I always associate with chiropractic care, is a car accident.
Yeah.
I don't know why.
Well, I know why. Because I don't want to get into that one right now. I'm not
for
having too
another
much of
for
a
the
charge.
hour-long show.
Yeah, right, exactly. But I mean, it helps people with that, but that's really not what it is. It's really so much bigger than that. And I'm not saying it doesn't help people with that. But after being a nurse, I said, I want to embark on a journey where I see people healthy, doing things to augment their health as opposed to, you know, medicate it all the time. Because when you medicate, especially for chronic problems, you know, one pill leads to two, which leads to four, which leads to a mess. You know, and so I have a lot of people that come in with like migraine headaches, asthma, digestive issues. And again, and I keep repeating this, it's not like I cure any of these things, but I am telling you this, when you release that pressure on the brainstem or the central nerve system, the body wants to heal itself. And I will tell you, probably 80% of people that come in with migraines or headaches, that within a month or two, they're gone or they're dramatically decreased, you know, and I don't cure it. The body cures it itself. You know, I'm kind of like the mechanic. I'm kind of like God's mechanic. I move the bone, and like people's spirit within heals itself. Your body's your advocate, not your enemy, and wants to heal
that.
you.
That's a good way of putting it. Now, let me ask you: do you ever get adjusted by maybe you know, one of your peers in the chiropractic world?
Yes. Excuse me. I've been getting adjusted, like I said, for 35 years, and every Monday night I meet with a group of chiropractors, and we talk about the science, the philosophy, and the art of chiropractic, and we spend an hour and a half to 2 hours every Monday night. So we fill our cup up so we can serve our people more. And all of us get adjusted that night by each other. And I have a chiropractor, and she's in Pompano, and I adjust her, and she adjusts me, and I get checked every single week. Now, understand, I don't always need to be adjusted, but I get checked every week because I want to be that clear, hollow vessel. Like, I feel like I can heal from anything. And I'm not kidding you here.
If you're listening on the radio, I mean, I'll tell you, Dr. Shore has great posture, great looking woman, and then people on Facebook Live can see, but I mean, maybe I should get adjusted because, like, I don't have that type of posture.
Well, and you may have subluxations.
You may have it.
And on your
Yeah.
hour show, I can show people how I feel for a subluxation.
Yeah, we may have to do an adjustment in studio. Maybe we could get the
Sure.
whole thing in here. We'll have to see, though. But no, we'll have to look into that in the future. That'd be
Yeah.
really neat. I know you mentioned it kind of before. How long have you been a chiropractor? Was it 30 years?
31 years now.
31 years.
Yeah, I was a nurse for about 7 to 10 years before that, and then I've been a chiropractor.
And how long in Delray Beach?
15.
15. Wow.
Yeah, I've been here
Okay.
15 years. Yeah, I had...
So you're established here in the Delray Beach
yeah.
community.
Yeah, if you walk down the street with me in downtown Delray, we get about 1 block without me, like I know so many people there. I'm very involved in the community. And one of the other things that I've done is I go on mission trips. And I've done...
I saw it on your website. Was it Panama last year?
Yeah, I've done 4 mission trips to Panama where we've adjusted. On one trip, we adjusted 200,000 people. And we were all over the country making a difference there. It's totally voluntary, and we don't get paid for it, and we just go there to serve.
That's great. I've had a few doctors on this show, and I'm really interested to hear those stories we may have, to get into that a little bit more on the hour-long show. But I want to ask you one more thing.
Okay.
We met at the Delray Green Market, as I've mentioned to the viewers before. My wife's a pastry chef, but you actually do a booth there every week, religiously, every Saturday, 9 to 2.
I'm there.
Tell me what's going on there.
Well, I go there so I can educate people about chiropractic. Like you, most people think that chiropractors are for neck, back pain, and car accidents. And so when people come around, I will actually do a preliminary check to see if they possibly have a subluxation in their spine. And I talk to them and I educate them, and hopefully they have an aha moment while they're there, and a lot of them do. And then I also, it's kind of like my Saturday morning hours. I see my patients there. They come down there, and I go, come down, have a croissant, and actually have good juicing.
Oh, there's a lot of great food there as well.
And go there and enjoy. And, it's just very good community relations, too.
Well, that's a great opportunity. Tomorrow, 9 a.m. to 2 p.m., Delray Green Market. You can't miss it, right downtown
Old
Delray.
School Square.
Old School Square, right next to the parking garage. I think you can put in 51 North Swinton Avenue into your GPS and get right there and meet the doctor if you have any questions. And if you have any other questions, check out shorechiro.com or call Dr. Shore at 561-278-2727 in Delray Beach. Dr. Shore, thank you so much for coming on the program.
Thank you. I so appreciate it. Thank you, everybody.
We're good. For a prescription to better health from the top doctors in the medical fields of cardiology, neurology, orthopedics, sports medicine, and primary care, join us each week on the How to Stay Healthy show.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily